Hi, good day everyone. Especially to you, sir. So today I will going to um, report or the oral final examination. So my first question that I choose is, what is a polygraph instrument? So polygraph instrument is basically a combination of medical device that are used to monitor changes occurring the body. A person is a person is questioned about a certain event or incident. The examiner looks to see how person um, heart rate, blood pressure, respiratory rate, and elect, um, electrodermal activity, uh, and change in composition to normal level. And my next question is, what makes peno what makes penograph component different from cardiograph components? So um, first, penograph. Penograph consists of two two 10 inches convoluted tubes fastened around the subject chest and abdomen. During a test, a circumference of the subject chest and abdomen increases with each inspiration of air, and pneumograph tube stretch as the subject exhales and contraction. It improves its function and records the changes of breathing and respiration of the subject. While the um, cardio, the cardiograph is an electro electrocardiograph. Machine tracks the electrical activities of a patient's heart by tracing lines on paper that reflect the electrical impulse of the heart. When someone is lying, usually accom- accompanied by an increase in heart rate and blood pressure, which is measured by cardiograph. So, now my next question is, enumerate the accessories that are going to be attached in the subject's body. So, when you sit down in the chair for a polygraph exam, several tubes and wires are connected to your body in specific location to monitor your psychological activities. And those are blood pressure cuff, which measures the subject's blood pressure, heart rate, and blood volume, as and penograph. It is a device that uh, measures the respiratory activity, breathing patterns of the subject. And a penograph is essentially a convoluted rubber tube. It is used law and determine how much resistance there is in the chest cavity, because there is more resistance in your chest when when your lungs are filled with air. And GSR, the galvanic skin response, is a protruding electrode which is used to determine um, the changes in a subject anxiety. An increase in anxiety will result in decrease of electrical resistance in the skin. So, question number 4. Enumerate some of the signs and symbols commonly used in polygraph examination. So, we had the numeric X, start for the test. Double X is end of the test. 60 is millimeter of mercury shown in sigmamometer dial. 1.5 is ohms of skin electrical resistance. And what we call it? Positive sign, yes answer to question, and negative sign, no answer to question. And A for adjustment, T is for subject talks instead of answering sign, yes or no. C is coughing, N for nose, L for laugh, M for movement, and what we call that? IM movement instruction, BI breathing instruction, and SN subject sniff. So my next question is, what is chart interpretation? So um, a chart interpretation is one is the interpretation of a polygraph chart. Interpretation normally involves in a comparison of physiological response to relevant questions, such as questions about issue that is focus of the enumeration, and responses to other questions that are asked for a purpose of comparison. So let's move to the next question. What are the important features of the examination room? So the examination room, which is also a material requirement, should be located in a calm environment wherein the examinee is not exposed to internal influence, with simple equipment and only a few pieces of furniture. Low stimulus area should be provided where nothing distracts and the attention of the examinee, who will thus able to fully concentrate on the examination. So question number 7. Um, discuss the 4 ways of polygraph examination. So we have 4 ways of examination. So our firm service being contracted, the examiner will meet the requester to polygraph examination, often known as the client, and in person or over the phone. So during this session, all case facts relating to the inquiry will be relieved and discussed. The client must submit accurate information to the examiner in this regard, and it will serve as the foundation of the polygraph examination. The client must do thorough inquiry to establish all facts. The polygraph examination takes place during this record phase. Just before beginning an examination, the blood pressure will be inflated to a pressure of 60 mmHg, and the examiner will then ask the examinee the series of questions that were formulated and reviewed during the pre-test interview. The series of the question will be asked a minimum of 3 times. As the examinee answered the question, his or her psychological data are continuously collected, measured, and recorded by the polygraph instrument. So during the last phase, the examiner will analyze and evaluate the physiological data by means of numerical quantification system, and will render on the following result. The examiner will give examine the result of the polygraph examination and discuss this result with him or her. So next question, number 8 question. What is the purpose of pre-test interview? So the purpose of the pre-test interview is the present phase consists of the questioning and the other preparation of the prospective examinee before the actual use of the polygraph instrument. The interview that is conducted prior to actual polygraph examination is vital of the diagnostic examiner, not only in obtaining records but also in the overall interpretation of subject truthfulness. And its goal is the goal or the main purpose is to increase the validity and the reliability of the testimonial survey evidence. So number 9 question. What is a silent test all about? So silent test uh, a silent test is a silent answer test. The silent answer test procedure has inherent testing objectional movement, meaning objectional it is based on fact or based on different resources. So inherent testing of objectional movement during movements resulting from or incident to required verbal response. The silent answer method reduce those effect by requiring less effort on the part of the subject during the test. So the polygraph charts are provided to illustrate the effects of each method. So we are now going to the last question. So who is the polygraph examiner? So for me, polygraph examiner is highly analytical people with excellent interpersonal communication skills. They combine knowledge and physiological and psychological to evaluate individuals to deceptive tendencies. Polygraph examiners are licensed and trained to conduct and give lie detector tests to witness, suspects, and other individuals involved in criminal trials. So I think that's all my final oral examination, and thank you for listening. God bless.